I don't know how CDC gets their money, but I'd love to see them get some money for the study of cluster outbreaks for ME/CFS, and also to study severe ME/CFS, the prevalence and the need to have them included in research, clinical, and drug trials.
Let me ask a procedural question of Dr. Belay. So when, just like we have made recommendations to ask the Secretary to instruct the NIH to issue an RFA, is there a CDC equivalent to an RFA?
No.
Is there a CDC equivalent to an internal? We asked the Secretary to allocate specific funds for CDC to examine the questions that she asked. Does that legitimately happen, or does the Congress appropriate a certain number of your dollars, and I won't say the Secretary has no input, but doesn't have direct input? I just don't know.
The funding comes from, the funding for CDC doesn't come from the Secretary. It comes directly from Congress.
From Congress. But doesn't the director of CDC report to the Secretary just like Dr. Collins reports to the Secretary?
Yes.
Isn't that correct?
Yes.
So I would argue that there is a connection there. Now, we'll find out later on if that's not right. So your recommendation would be that the Secretary instruct the CDC to develop studies that would examine severe ME/CSF patients and, what was the other? Cluster outbreak. Okay.
Cluster outbreak patients, and also and looking for the
Cluster outbreak as a basis.
ME/CFS cluster outbreaks, those patients.
And, further studies that would involve.
Would you like to have that one in collaboration with CFSAC members as well, given the fact that then we could help them hammer out more what you have in mind, if the Secretary was kindly affectioned to consider it?
Maybe. I mean,
you guys are already ex officio members,
is already talking to Dr. Peterson and is already networking with the doctors.
Would there be any value to that, Beth? Or Miss, I'm sorry.
I'm a little bit confused. I think I need clarification of what the recommendation is exactly. I mean, if we're saying study CFS patients,
It's
severe
two
patients.
things. It's two things. We're looking for the CDC to study ME/CFS patients who were involved in various cluster outbreaks, because we can learn from that we haven't done that really well. And the other thing is to study the population of patients, we don't know the number, maybe 25%, who are severely affected, looking at them as more there's the severity of their illness, the prevalence of the patient population that is considered severe, and the inclusiveness of them in studies, so that when we do these studies, we really get an idea of what this disease is. If we always exclude them from studies, it's coming out like CFS light,
The spectrum.
The spectrum, I didn't mean to be like flippant, but I just didn't know the right word.
Okay, so the recommendation is that the Secretary would instruct the Director of CDC, or just instruct the CDC to develop funding for cluster outbreak studies and analysis of severe ME/CSF patients.
How about the epidemiology?
Can I suggest a friendly amendment? That the Secretary find resources to fund, because if it's in CDC, it's in CDC. If it's somewhere else, it could be somewhere else. Just a request for flexibility rather than...
The only question is that Miss was suggesting that CDC's budget comes directly through Congress, not through the HHS. So then she has to allocate non-CDC money, HHS money, to CDC.
The clarification, HHS could request funding for CDC through the president, but eventually it's up to Congress to
but we got the president's ear right now, so let's take advantage of that.
I think what Steve was saying was that giving the flexibility that maybe CDC isn't the right group to do it. Am I putting words in your mouth?
Well, clearly cluster outbreaks would be in your bailiwick, because that's epidemiology and that's one of your expertises, presumably. And then the severe, I'm not so sure about severe chronic fatigue syndrome, ME. I mean,
one idea could be that it could be tagged onto the existing studies that you're doing with the other investigators, and to
these are all really, really good ideas, and we're very aware of the need to include severe patients. We talk to our clinicians about how to best do that. This particular study may not fully get there, but we're definitely aware of it. We're also aware of the need to address cluster outbreaks in some way, and what the best format for that is. One possibility is even coming up with guidelines for use to put out at the states. Okay, if you see a cluster, this is the samples you should take, this is the information you should take. So sort of an awareness kind of building. We don't necessarily, I'm just telling you we're aware, and how you want to best handle it is a question.
Okay, let's call the question so that we can move forward. And I guess what would be important would be to be vague enough to give the CDC or the secretary the flexibility to where the money should be placed, but specific enough that she understands what it is that we're asking for. So something to the effect of that we would recommend that the secretary allocate specific funds to study CFS cluster outbreaks, and I think everyone would know that would go to CDC.
Why don't we make two separate recommendations, one on cluster outbreaks and one on severe chronic fatigue syndrome?
Okay, so we'll do the cluster one first in ME/CSF patients. Okay, so we got that as a motion. Second, any discussion? Yes. All in favor?